Everybody's heard of hernias. Many people have them. Some people even ignore them. And that really is not good. Hernias can be corrected. Doctor, what do you do for hernias?
A hernia is basically a defect in your abdominal wall. So if the continuity of the abdominal wall is disrupted, then it is essentially a hole. And when you cough or you strain, your intestines are sort of popping out, and that's what you're feeling under your skin. The most common hernias, which most people are familiar with, are groin hernias or umbilical hernia, which is a hernia in the belly button. Those are usually the more common type of hernias which we treat. Another very common type of hernia we treat are what we call incisional hernias. So when the patients had a surgical operation done where an incision was made, they can develop a weakness in that incision, and that can present as a hernia.
Essentially, doctor, what causes hernias?
Certainly patients which do very vigorous physical activities where the intra-abdominal pressure is very increased. So patients who are lifting weights, that's why you traditionally see patients wearing belts when they're lifting significant amount of weights. Patients with chronic cough, who are coughing on a more regular basis. Again, anything which can increase the strain or increase the intra-abdominal pressure will increase your chance of developing a hernia.
Are there benefits to doing this procedure laparoscopically?
The usual benefits which we have on laparoscopic procedures are a quicker recovery and less pain. A good analogy is fixing a hole in a tire. When we do a traditional hernia repair, we're basically patching the tire with a patch from outside. In a laparoscopic repair, what we're doing is patching it from the inside, which we all know is a better way to patch the tire, is to put the patch inside. This way, if a patient is doing any heavy lifting or exertion, when they increase the pressure, it actually strengthens the repair and does not weaken it. Postoperatively, in a traditional hernia repair, we would tell these patients not to lift any weights for the first 4 to 6 weeks. Now, if these patients have no discomfort, they can go back to physical exercise and lifting weights the very next week after surgery. So they're able to go back to their full physical activities in a very short period of time, and again, have very little discomfort. So I think overall, the benefits can really go just beyond to the patient.
Is it possible for this kind of procedure to fail or for the hernia to recur, come back?
There is certainly a small incidence of recurrence, but we have now seen that the incidence of recurrence or a hernia coming back is significantly lower with the laparoscopic procedures as compared to the traditional open procedures. So the recurrence rates have also gone down with the procedures being done laparoscopically, because we're getting a much bigger and better repair than we would with traditional open surgery.
And for someone who does have a hernia but kind of ignores it, in the long run, is it important to have it attended to?
The most thing which patients fear is the hernia getting strangulated. I'm sure you've heard the word strangulated. What that really means is that that piece of intestine which is popping in and out, it'll get caught, and then the blood supply is compromised. So from a simple thing, it can become a big, more complicated procedure, possibly involving removal of portion of that intestine if it is completely dead. So that's why we really want to be able to fix the hernia in order to avoid strangulation.